Have you ever felt this within yourself? That one moment you're full of extreme energy, and the very next moment you feel completely exhausted, broken, and empty. Sometimes you feel happy, confident, and unstoppable for months, and then suddenly a deep sadness, hopelessness, and helplessness pulls you down. Maybe you've even asked yourself, why do I feel like two different versions of myself? One that can conquer the world, and one that can't even get out of bed? The answer often lies in something people still misunderstand: bipolar disorder. It's not mood swings. It's not overreacting. It's not being dramatic. It is a real medical, neurobiological condition affecting 40 to 60 million people worldwide. Hello, everyone. I'm Dr. Syeda Quadri, a U.S. board-certified psychiatrist, and I've been working in the field of mental health for the past 15 years. And today, we will specifically talk about the symptoms of bipolar disorder and the reasons behind why it occurs. Here's the truth. Bipolar disorder can begin at any age, but it most commonly appears during the teenage years or early 20s, right when life is just beginning. Science makes one thing clear. Bipolar disorder isn't about being too emotional. It's about the brain's mood regulation system suddenly shifting to extremes, sometimes extremely high, sometimes extremely low, and sometimes both at the same time. So now let's understand its symptoms. First, mania. Mania and hypomania look similar on the surface, but mania is far more intense and dangerous. During mania, a person's work, school, relationships, and daily functioning can fall apart, and in some cases, they may lose touch with reality, a symptom called psychosis. Severe mania often requires hospitalization. Here are the key symptoms, rewritten clearly. 1. Overactivity. Energy skyrockets to the point where sitting still becomes impossible. The person may feel overly excited one moment and suddenly irritated the next. Their mood keeps shifting rapidly. 2. Overconfidence. They may feel invincible, as if nothing can go wrong and every idea is brilliant. This inflated confidence often leads to dangerous decisions. 3. Sleeplessness. The brain runs so fast that the body stops feeling tired. Sleeping just 2 to 3 hours can feel like enough. The person genuinely believes they don't need sleep at all. But this lack of sleep makes future episodes far worse. 4. Fast, pressured speech. Speech becomes extremely rapid, as if the brain and mouth are racing together. Others can barely keep up with what the person is saying. 5. Racing thoughts. Thoughts fire at high speed, one after another. A new idea pops up before the previous one is even complete, creating a nonstop mental rush. 6. Distractibility. The mind cannot stay on one thing. A sound, a light, a notification, anything can pull attention away instantly. This hyper-alert state makes work, studying, and conversations very difficult. 7. Impulsivity. Decisions are made without thinking, suddenly spending large amounts of money, risky sexual behavior, or reckless investments. It feels right in the moment, but the consequences later can be serious. Second, hypomania. Hypomania is a milder form of mania, not intense enough to derail someone's entire life, but strong enough that noticeable changes appear in mood, energy, and behavior. 1. High energy. In hypomania, people suddenly feel unusually good, lighter, faster, and full of energy. Work gets done quickly, productivity shoots up, and everything feels in control, almost like they're operating at their best. 2. Social boost. Hypomania can turn someone's social energy way up. They become more talkative, more outgoing, and far more expressive than usual. At work, they may appear extremely confident. In social settings, they might become the center of attention. On the outside, this looks like an upgraded version of the person. But this sudden social surge is actually an early sign of mood imbalance. 3. No awareness. During hypomania, people usually believe nothing is wrong. In fact, they may feel like they've become the best version of themselves. Because their mood and energy feel good, they don't realize the shift is abnormal. 4. Noticed by others. The tricky part is that others notice the changes first. People around them can see their mood rising too fast, or their energy and activity levels not matching their usual personality. To family and friends, this sudden increase in speed, excitement, or irritability feels different, odd, or out of character. 5. Crash risk. The biggest danger of hypomania is the crash that follows. High energy can suddenly drop into deep sadness, exhaustion, and hopelessness, leading straight into a depressive episode. Third, depressive episode. The depressive episodes in bipolar disorder are similar to major depression. They deeply affect mood, energy, thinking, and behavior. 1. Overwhelming sadness. A heavy emotional weight sits inside the chest, a sadness that stays all day and doesn't fade on its own. 2. Low energy, fatigue. The body feels drained, as if all strength has disappeared. Even small tasks feel like climbing a mountain. 3. Lack of motivation. This isn't a lack of desire. The desire is there. The problem is that the brain won't start. You think, I should get up and do this, but the next step doesn't happen. Everything feels slow, heavy, and pointless. This is not laziness, it's depression's shutdown mode. 4. Hopelessness and worthlessness. A constant sense that nothing will improve. Negative thoughts about oneself play on repeat. 5. No pleasure. Activities that once felt enjoyable, music, hobbies, friends, no longer create joy. The heart feels emotionally numb. 6. Foggy mind. The brain doesn't process information the way it normally does. Thinking feels slowed down, as if mentally moving through a thick fog. Simple decisions, what should I eat, what should I start, feel difficult and overwhelming. It feels like the mind simply can't work. 7. Crying spells. Tears come suddenly, sometimes without a clear reason, and once they start, they are hard to stop. 8. Irritability. Along with sadness, irritability increases. Small things feel frustrating and emotionally overwhelming. 9. Oversleeping. Some people sleep 10 to 12 hours and still wake up exhausted. The body feels heavy, the mind feels slow, and the whole day goes by in low energy mode. This isn't laziness, it's a strong sign of bipolar depression. 10. Appetite shift. Some lose their appetite entirely, leading to weight loss. Others eat more than usual, often emotionally, leading to weight gain. 11. Insomnia. Some people stay awake the entire night. The body feels tired, but the mind won't shut off, as if a constant noise is running in the background. Even with closed eyes, the brain keeps spinning, leading to an exhausted, heavy next day. 12. Suicidal thoughts. Depressive phases can become so dark that thoughts of death or suicide appear. This is a medical emergency. If these thoughts arise, talk to someone you trust immediately. Contact emergency services or crisis support right away. 4th, mixed episode. A mixed episode is one of the most intense states in bipolar disorder because the brain pulls in two opposite directions at the same time. 1. Dual storm. A mixed episode feels like a split inside the mind. There's extremely high energy on the outside, but deep sadness and emotional heaviness on the inside. It's like speeding forward while sinking at the same time. 2. Agitated low. The body feels restless, you want to move, pace, stay awake, but emotionally, there's hopelessness, fear, guilt, and a painful emptiness. The body is on high alert while the mind is in low mood. 3. Restless pain. Your thoughts won't calm down, the body won't slow down, and yet the heart feels heavy and overwhelmed. This combination creates one of the most intense emotional pains a person can experience. 4. Danger mix. In this state, dark or suicidal thoughts may appear, and because the energy level is high, the risk becomes even greater. That's why doctors consider mixed episodes one of the most dangerous phases in bipolar disorder. 5. Worst phase. People who have lived through mixed episodes often describe them as the most confusing, exhausting, and emotionally painful part of bipolar disorder, restless yet depressed, energetic yet hopeless, both happening at once. We've seen and understood many of its symptoms. Now, without any delay, let's talk about the possible causes behind it. Causes of bipolar disorder. Bipolar disorder doesn't come from one single cause. It develops through a combination of biological, emotional, and environmental factors. 1. Genetics. Scientists agree that genetics play a major role. Having a close family member with bipolar disorder increases the risk, but it does not guarantee that you'll develop it. Genes increase vulnerability, not destiny. 2. Brain chemistry. Bipolar disorder involves changes in the brain chemicals that regulate mood, energy, motivation, and thinking. In mania, these chemicals become overactive, and in depression, they drop sharply. This chemical shift drives the extreme mood swings. 3. Brain structure differences. Research shows subtle differences in regions of the brain, responsible for emotional regulation, thinking, and impulse control. These differences can make mood stability harder, but brain scans alone cannot diagnose bipolar disorder. 4. Trauma and stress. Major emotional stress, a breakup, loss, illness, financial pressure, can trigger manic or depressive episodes. For some, childhood trauma or long-term stress activates genetic risk and pushes the mood system off balance. 5. Major life changes. Events like marriage, divorce, relocating, or job changes can destabilize the mood system. A bipolar brain is unusually sensitive to rapid transitions. 6. Sleep disruption. Sleep is one of the most powerful triggers in bipolar disorder. Even 1 or 2 nights of poor sleep can activate mania or deepen depression. A small shift in the body's internal clock can disturb the entire mood cycle. 7. Substance use. Alcohol, marijuana, and stimulants like cocaine can rapidly worsen both manic and depressive episodes. In some cases, they trigger the very first episode of a person's life. 8. No single cause. Bipolar disorder doesn't come from one reason. It's a mix of genetics, brain chemistry, stress, sleep, and environment. Each person's pattern is different, which is why the condition is complex. Bipolar disorder is not something to fear or feel ashamed of. It is a medical condition affecting the brain's mood system. Your high phases are not your fault, and your low phases are not a failure. This condition can affect anyone, and it arises from a blend of genetics, brain chemistry, stress, sleep, and life events. But here is the most important truth. With the right therapy, mood tracking, sleep stability, medication, and consistent support, the brain can find balance again. People live stable, meaningful, productive lives. Yes, even with bipolar disorder.